Whoa, 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 whoa.
Think about it. Healthcare-associated infections are killing more people than AIDS, malaria, and tuberculosis together. We are talking 16 million deaths. So it's clear that this problem is gigantic, and the burden of disease is huge here in Africa, and we can help to solve this issue. Hand hygiene is the main key factor for infection prevention reduction. Now the problem of hand hygiene is that you cannot use soap and water hand washing. So the solution here in Africa, like it is all over the world, is alcohol-based hand rub solution. The goal is to make sure that alcohol-based hand rub is made available for all healthcare practices here in Uganda and hopefully in the future in the rest of Africa. It's a social innovation project. This is fantastic. This is quite an emotion. Okay, on y va. Uganda, acte 2. So next.
We are going out of this new
Yes.
building.
Hello. Alcohol-based hand rub formulation has been introduced in the WHO Essential Medicines list. It means that this is almost human rights, which is very, very important. The alcohol-based hand rub solution should be available at the point of every patient care. The availability at the point of care is the prerequisite for the multimodal strategy for changing the behavior of healthcare practitioners during patient care.
One of the biggest challenges when it comes to adopting to the use of alcohol hand rub is mainly the cultural shift. So we need to do much more training, much more sensitizing, not only to the healthcare workers, but also to the hospital administration for them to appreciate the need for alcohol and begin procuring it for the hospitals so that they can stop using soap and water.
Alcohol should be accessible and it should be affordable. Here in Africa, it's a lot more complicated. Alcohol production is relatively cheap, but the transport of alcohol is really a problem. So the only solution, and by far the best solution, is to produce alcohol locally.
We found out even at the hospital in Uganda, they don't have any alcohol hand disinfectant. We opened up our own company here in 2011. So we have to create the demand from scratch. And that part was most important and also difficult for us.
The main reason for our team to visit Uganda was to visit a sugar factory that is linked to the capacity to develop alcohol-based hand rub formulation.
This was originally started in 1930s. We extract sugar to the point where nothing is left when we can't do it anymore. So total area for Kakira is around 15,000 hectares. All of the canes, it would have been lack of rain.
Normal?
Yeah, normal.
And then that was lack of rain.
All the employees, majority of them stay here. 7,500 people, around 4,000 houses, 14 primary schools, 1 secondary school, one of the best in the whole region. We have a supermarket, we have bank, we have post office, we have ATM machines, we have this guest house, we have a theatre, then we have recreation centers, then we have 100-bedded hospital, which is all paid by the company.
This is a fantastic social project that is so important for the activity of the region. The catchment population for the hospital is 35,000 people. Access to care is free.
Our crushing capacity is 7,500 TCD, tons of cane per day. 750 tons of sugar.
The sugar cane is harvested, it is then cutted, it is sliced, it is then mashed and pressed so that you can extract the juice. Then you filtrate the juice and then you produce the sugar. When you have squeezed the sugar cane, there are leftovers. Now what you can do, the mash can be used to actually prepare alcohol.
We are producing 60,000 liters of alcohol per day, 2 million liters of alcohol per annum.
In addition to that, we have an alcohol-based handrub production site that is in the plantation, benefiting from everything.
Saraya, they are one of the best in medical sanitation is concerned. We haven't charged anything to them. I mean, we have given them the place, power, everything, security, everything. It's just a corporate responsibility. Yeah.
In the factory, we are producing two ranges of products, categories. We have the ethanol-based and the soap-based products. During the production of ethanol-based products, actually, apart from receiving the raw materials, the first step in production is always dispensing. Then we follow by mixing. From mixing, then we go to filling. From filling, we go to packaging. After packaging, then the product is ready to the warehouse, ready for shipping out.
Yeah, we already created some of demand here, and working together with the Ministry of Health or the WHO campaign.
In terms of volumes, how much we're able to sell, we're making significant differences. We should be able to sell out maybe about 30,000 liters in a year. Of course, that, when you look at the need for the alcohol and the potential of the market, is a very small percentage, but we believe we're on the right track, and everything going great, we should be able to double that in maybe about a year or two. If we see the volumes that we are producing are all being consumed, with more demand coming in, that would make me extremely happy. But for now, I am happy with the progress that we are making.
Our dream is supplying the whole of East Africa, because that is our dream.
And the objective is not to make money there. We will reach break-even by having the cost of the formulation as low as possible, but make it the project sustainable on the long term to produce alcohol-based handrub for all hospitals in Uganda and probably for many others in many countries in Africa. This is to me a dream, and that's a reality now in 2018. And in Africa, where access to alcohol is so complicated, this is the solution.